I believe insulin resistance is one of the most deadly diseases in the world. As a doctor, I'm shocked by how many people I diagnose with this. And here's the crazy thing, almost nobody knows they actually have it. In this video, I'm going to explain what insulin resistance is, goes why I believe it's even deadlier than smoking. And man, this continues to shock me even as a doctor, and why it is essential to start taking measures as soon as possible to start reversing it. I'm also going to show you how this specific information is helping one of my patients prevent a heart attack. Let me start by telling you about the biggest mistake that I've made as a doctor. When I started practicing years ago, I did exactly what I was trained to do: see a patient, diagnose a problem, prescribe a medication. High blood pressure, boom, there you go. You name the problem, I name the medication. Actually, I would name 5 to 10 medications to choose from. I pretty quickly realized, though, that something wasn't right. Patients would come back to see me 6 months later, not really doing any better at all. In fact, they were getting sicker. It's almost like I was missing a piece of the puzzle. Now, this right here is the last piece of the puzzle that my girls and I are currently working on. As mean as it is, I find it a little too fun to tease them and hide the last piece from them. Anyways, as I was sitting with these patients in my office, I couldn't help but feel that someone was hiding that last piece of the puzzle from me. As I began searching for whatever it was that I was missing, it became very, very clear that the problem is insulin resistance. To help my patients actually get better, the answer was not medication. It was fixing the root cause of their problems: insulin resistance. Understanding insulin resistance can literally save your life. So what exactly is it? I'm going to explain the science to you, but here's the most important things you should know. This is a condition where there is an overabundance of sugar or fuel in the body. It is most often caused by being overweight or physically inactive. Most adults in the United States have it. Over 40% of young adults have this, and it only increases with age. There are often no signs or symptoms of this disease, and you probably don't even realize you have it. Insulin resistance is the root cause of over 30 major health problems, including heart attack, cancer, and dementia. Finally, most doctors are not checking for it, and many don't even know how. Imagine you're packing for a big vacation. You're trying to save some baggage fees by fitting everything into one suitcase. You fill the suitcase up until it's almost bursting, but then you realize you forgot your swimsuit. What do? Well, if you're like me, you can find a little extra room by opening those pockets on the front of the suitcase. By the time you're done, the suitcase is literally bursting at the seams and definitely probably weighs over 50 pounds. Now, the cells in your body are like a suitcase, and glucose, or blood sugar, is the clothing you pack inside. Insulin acts like a zipper, opening the suitcase so blood sugar can be stored and used for energy. After a meal, blood sugar levels rise and the body releases insulin to unzip the suitcases, allowing glucose to enter the cells. Normally, this process runs smoothly, but with insulin resistance, the zippers start to get stuck. The body responds by producing more and more insulin, trying to force the suitcase open and open those little zippers on front. By raising insulin levels, you are effectively forcing more and more clothes into the suitcase. Over time, the problem gets worse. The suitcases are overstuffed, no more blood sugar can fit inside. At this point, even super high levels of insulin can't keep blood sugar down, which leads to prediabetes and diabetes. All that extra sugar starts spilling over into other organs, and you start accumulating fat around the liver, around other organs, and most importantly, inside of muscle. It's like having a growing pile of clothes on the floor with nowhere to store them. That pile of clothes, all excessive and disorganized, is insulin resistance. I think that's a great example, but what does this actually mean for your health? Here is why I believe this is more dangerous than smoking. Remember, more than 40% of adults in the United States have insulin resistance. That's compared to about 11% of adults who smoke. The negative health effects of smoking are very obvious, but what about insulin resistance? Well, we already mentioned that this can lead to excessive blood sugar and eventually diabetes. What is most surprising, though, is that even if we ignore the possibility of getting high blood sugar, Insulin resistance can cause a lot of inflammation, dysfunction, and damage throughout the body. Imagine all those suitcases and zippers getting broken and damaged. We've discovered that insulin resistance can lead to some terrifying conditions like metabolic syndrome, heart attack or stroke, chronic kidney damage, PCOS, fatty liver disease, cancer, dementia or Alzheimer's. There are actually 31 different diseases in total that come from insulin resistance, causing just as much damage as smoking, but without you ever noticing. This really is the silent killer. Any doctor will get in your face and tell you to stop smoking, but when's the last time they told you that we need to check for insulin resistance? This is not a condition that doctors are checking for, so many people do the same thing day after day after day, unknowingly causing a lot of damage in their body without ever knowing anything's wrong. I'm just full of positive news today, aren't I? Here's the thing though. The reason I started this whole YouTube channel, that I'm focusing in on this particular topic, is because I believe having the knowledge about it and knowing what to do about it can truly save your life. This is like the biggest problem we're facing with our health right now, but there is very good news. Remember that heart attack patient I was telling you about? I recently diagnosed this person with heart disease based on a CT scan. It showed that they had plaque building up in their heart vessels. This is always a scary diagnosis because if it goes on unchecked, it can lead to a heart attack down the road. My client was actually a bit confused as to why this was happening. Cholesterol was fine, his other labs were normal. Remembering the lesson I learned about the last piece in the puzzle, we decided to check for insulin resistance. Sure enough, they had it. They were actually very disappointed and discouraged to hear this, but those feelings changed when I shared the good news. And yes, this is the good news that I was talking about. Insulin resistance is 100% reversible. Yes, 100% reversible. I helped get this client on a path to reverse their insulin resistance, and I am very confident if they're able to do so, it'll help reduce their risk for a heart attack. I've personally seen insulin resistance turn into diabetes within a matter of months. What is happening now in your body will determine what happens a couple months from now and even decades from now, such as the case with something like dementia. Look again at some of these conditions insulin resistance can cause. It is so important to start making steps to reverse this as soon as possible. The sooner you do, the less likely you'll be to get all these terrible problems. So how do you actually reverse it? Check out this video here where I show you how one of my clients reversed not only insulin resistance, but type 2 diabetes. And get this, he did it in 3 months.